We got a 1 o'clock appointment with Dr. Fujita, Murad Tolbert, Gary Walker. We here from LA Shot. Just came to get right.
All right. Go ahead and sign in, and we'll get you going.
What's going on, Doc? What's going on? Ready to go, man. Yeah. Candy, because we know you're going to take care of us, man. Legitimately, it was actually kind of sort of because me and Harold went and ran routes.
I saw that shit. And then what part?
It's right here, right
in the bottom,
same spot.
Right side versus left.
It's right in the middle.
Right smack in the
Yeah,
middle.
right in the middle.
And yeah, a lot of time. All right, cool. Let's check it, man. Go ahead and look. Twist out. But we have like a combo like their oils. I tried like the nighttime. That thing's still protecting anything. That's what the big one now, man. So it's right still in the going. Back up. Back up. When you get right here, it's gnarly. That's actually not bad. So I can scrape if I want to with this, and I can work through just the neuromuscular.
Yeah, neuromuscular. Please.
You say yeah. So easy.
Definitely gotta get this scar tissue out, though.
So you got him under that one? Stretch that out and go ahead and press up and go and push up. 6, 5, 4, 3, 2, 1, and drop. So when you're having your pain, is it really high up? Is it in the middle? Is it low?
It's like kind of low. It's low, and what we're doing when it happened. While I was running, I did like a juke move.
Okay.
And that's when I just felt it tighten up.
Got it.
So I was like, whoa. So I kind of cooled it down. I still continue to play a little bit, but more like 50-60%. And it happened about 2 weeks ago.
Okay, cool. Come right in. Check it real quick. I'll check your flexibility on your back. I'll check your flexibility. I'll palpate it with your differential and put your biceps femoris versus your medial hamstrings. And then we get a good stretch or anything. Go right there, and again,
Just in a hamstring, but
right
so
smack
like in this area right here.
Gotcha. Go ahead and roll range down. Now the quick and dirty. Usually do it on what you rotate your way down. And go ahead and flex your heels to your butt. And pull. Any problems with that?
No.
No. Switch. And pull. Any problems with that?
No, pretty good.
Okay. Of the two, none of those are giving you reproduction of any of your symptoms. So it's doing pretty good then, is what you're saying.
Yeah, pretty good. Strength is there for sure.
Good.
Right there and there is like block. Feel like get a little tender.
Get your biceps washed.
Right there, tender.
I got you. Okay. So from your hip up and then hold strong. And push up. Push. So glutes pretty strong. So good news. So usually again, hamstrings, one of three things. Flexibility issues, glute weakness, that matches kind of with hamstring weakness. So what happens is you use your hamstrings as a hip extensor, which it does, instead of your primary hip extensor. So a lot of times with football players, I'll come in, do big old linebackers, and a lot of hamstring problems. I'll go and pretty much test their hamstrings versus their glutes. So straight up is your hamstring and your glute, but lift it straight up. And what that does is it'll give me a complex idea. Turn off your back musculature, and then just hold up, push up, push up, push, 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 and see with your hamstrings, it picks up both. And so it tells me how much they work together. Then when you bend it, you put it on shortened. So you take out your component of the hamstrings, you hold your glute there, hold up, hold up, hold up. Active insufficiency, so wasn't moving forward. I can get the name part out of my brain. And push up, push, 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 push. And again, you test the glute. Now, a lot of times I can take these legs and I push them straight down. So good job. You guys, as a program, have you adopted, or even like with Baltimore and a lot of the universities and stuff too, they started digging into making sure to do a Nordic program, like 1 splice 2 times a week for hamstrings to get better hamstrings? Yeah. And that's what you want to do too. So you want to do what's called, so a part of our program here, which is I think a little different than for the athletes, is yes, you can fix a hamstring. Yes, you can break down scar tissue. Yes, you can re-strengthen the hip muscle. Yes, you can re-lengthen the hamstring muscle. But what you do is, they forget a lot of times, is to do the functional lengthening and the functional strengthening. So like your Nordic hamstring drops is more of a functional lengthening and strengthening component. Like Romanian deadlifts, for instance, going through that full lengthened position and then squeezing all the way out using the whole complex. And then on top of that, then adding dynamics onto it. So like, suicide drops are dropping down off of a box and doing the eccentric loading, and the secondary movement where you explode off of it.
Push it on.
Exactly. And so what a lot of clinics do, and this is where, I don't know, we find a lot of flaws when we get a lot of athletes from other clinics, they stop not only at just the pain stuff, they don't even retrain the sport specific stuff at all. They don't recondition it. And then again, the goal is to eventually, and this is what I do with, well, most of the athletes, especially like Murad, or as I do with Dr. White, is getting to the point where we're at that functional stuff. I dig into the nerdy biomechanics and the research showing, okay, if you do this, then this, and you have this, and I say, but go back to the right, start strengthening up your hips, start getting your core right, start getting your running program back on. And that's where we kind of do that whole transition, one versus the other, PT versus personal training, which helps out quite a bit. And that's where it keeps that relationship stays nice and clean.
Now you're gonna think shorter. Appreciate you. Work was great. Good day.
Dr. Matthew Fujita, I'm an orthopedic physical therapist out of Norco, California. We've had the chance to work with amazing athletes here, spanning all the way from NFL, MLB, MLS, to just regular post-op care here. We love having people in. We take care of them. We get them ready fast. And I can't think of anything better to do with my life. My favorite part of working with athletes is I appreciate the fact that these guys have been highly trained, highly molded into machines, man. But just like any machine, there's little kinks sometimes, there's little breakdowns. And the best part of it is I get the chance to find those little breakdowns. And part of it's comfortability too. So like if you have a Ferrari, you're not going to take it to your regular tune-up at a Honda dealer. You're going to take it to a guy who's comfortable with Ferraris, who knows the parts and has driven even a Ferrari, man. So again, here it's nice to get these guys in and be able to pick those things apart, little pieces, put them back into their main game, and then send them back off. And it's just the best part of working with athletes. It's just a little differential of working with the common public too. So it's not good or bad, it's just different, and you got to be prepared for that. So one of our biggest obstacles when working with any elite athlete, even down to the high school level, your recreational athletes, is some of the medical team that's been established. Now again, I've been able to work in professional models where you have access to the orthopedic, the general physician if necessary, the AT, the strength coach, the personal trainer, you name it, it was an awesome experience. And then I got out to the regular public and realized that these teams don't exist. So here in Norco, we've done a great job creating relationships with our MDs, our orthos, with our athletic trainers, our personal trainers, so that nobody wins but the athlete. And so we've taken out competition and we're able to reinstate just a thorough medical team, and then we just make sure we keep good communication with it. So, I mean, that's one of our biggest flaws, at least out in the local community and doing private care, not under a professional model. Another big thing we have an issue with is insurances. Now we're trying to help these more, again, we're talking about the college and recreation athletes, just like our high school athletes who have differing levels of insurance, and they just need navigation on how to get there fast. So they're not waiting for an MRI for 4 weeks, then waiting for the doctor for 2 weeks, and then getting surgery 2 months later. Well, the season's gone by then. So we really try to help them navigate it. And the last thing we've kind of seen with working with athletes is some of our elite athletes, our Division I athletes at college ball, even some of our pros, come back and their care was either too aggressive, where they were getting back too fast and everything wasn't tackled appropriately because they're now a commodity and the money is speaking, or there was fear from above, coaches, the organization itself, that if you didn't get this person back fast enough, you're being frowned upon and you might even lose your job. It's been nice in the private sector because I don't have to worry about that. I can treat these guys as thoroughly as possible, give them clean timelines, and then work within the rest of the medical team to say, hey, here's exactly where they're at, and then we like to pass that and say, okay, now it's your turn, and they're able to go back to their respective teams, trainers, and they keep on going, at least with a better model in view. So the best advice I have for practitioners is just to make sure you get out there, make sure you hit sidelines. Don't be afraid to not know about sports. Go talk to the coaches. Be a coach. Shoot, man, it's the best way to learn a sport. That way when you get these patients in, you can specifically treat them and know what those next levels are. For players, your job is to be a good consumer. Ask a lot of questions. If you have a practitioner in front of you and they don't know the answers, they don't know your job, look for another answer. It's okay. Make sure you're responsible for the care that you're getting. So the best part about partnering with the LA Shock is they're like-minded and they're altruistic. They're going to come into this community and they're going to make it a better place because they're here to help give back. It's not to take. They're not trying to find angles. They're like our clinic. This is my ministry, and likely this is their ministry. It's via sports, but it's still set up to support God, the church, the community. And I'm most excited to work with them because it's the same team, it's the same mindset without any breaks, and it's a comfort that not only I can have, but you can have when you're encountering us or the LA Shock, is that we actually have your best regards in mind, that we have no harm for you. In fact, we want you to be the best you can be, and the community is going to do nothing but grow from it.